Hi there. I wanted to take a moment to talk to you a little bit about the differences between the fitness challenges and HIIT training and how to use a fitness challenge for HIIT training if it is something that can be utilized in your protocols. First of all, the fitness challenges are written to be very specific each week to target some areas that you will not get in your usual uh, resistance training and typical cardio protocols and with whatever else you're doing. They're meant to balance out the program with some agility training, additional core training, and a type of cardio that is not steady state. It is not low intervals and it is not quite high intervals. It is really meant more of an intensity metabolic blaster. So those are written specifically for 40-second work with 20-second rest or some other variable on that to have you push yourself within those time frames or that rep frame to do the best that you can within that time or that rep range. And so they can be adjusted to fit your fitness level. So when it is indicated in your program as a fitness challenge, please do it exactly as it's written. Now, of course, you might need to substitute some other exercises if you have some limitations or equipment issues. But if you can, try to stick as closely to the program as you can. Now, those fitness challenge moves can be incorporated wonderfully into HIIT training where you use your heart rate as your guide. And your heart rate for a HIIT training is to use the information we have on that heart rate chart so that you go way up between 90 and 92% of your age-adjusted max heart rate for a period of time. And it can often be unspecified, but it's usually less than 30 seconds because your body will tell you you can't go on for more than 30 seconds usually. And then you take the time it takes to recover. And you can do that by either stopping the activity or doing something light until your heart rate drops down below 60 to 65%. Then you pick it right back up and you go way back up. And so however many times you can get that done within your suggested HIIT protocol time sequence is how you do your HIIT training. So you could do that on a machine, or you can do it with your body weight, or you can do a combination. So hopefully that helps. Fitness challenges are very, very different from what a HIIT training is. And then of course we have other types of cardio such as low interval training and as well as a steady state. So if you have low interval training, I also call it afterburn if it's added on to an additional existing type of cardio or a low interval training sequence. It's usually between 65 and 85% of your age-adjusted heart rate. Those can be done more often, but usually HIIT training between 20 and 30 minutes per week 20 and 30 minutes per session, no more than 2 to 3 times per week is really all that you need to do. And then we utilize the other types of cardiovascular overload to continue to condition your body to meet your goals. So hopefully that helps to explain the differences.